Today we will be conducting a demonstration on Leopolds Maneuver. But first, we need to wash our hands to deter the spread of microorganisms and to prevent contamination. So I'll be right back. Now we need to explain the procedure to the patient to inform the client what assessment will be conducted today. So, good day, ma'am. I'm your student nurse for today. My name is Azia Michael J. Velasquez. By the way, let's just assume that this is the patient. So today we will be conducting an assessment on Leopolds Maneuver, which will be consisting of 4 maneuvers. So first maneuver, second maneuver, third maneuver, and fourth maneuver. Do you have any questions or clarifications? Okay, thank you. Now we need to let the patient empty her bladder before the procedure, since a distended bladder may slightly deviate the uterus and it allows for a more productive examination. Okay, ma'am, do you need to void? Okay, thank you so much. Now, we need to provide the patient with privacy to preserve patient's dignity. As you can see, the door is already closed. Now, we need to position the patient on the supine position with one pillow under her head and with the knees slightly flexed and placing a towel beneath the patient's hip. This will displace the uterus of the inferior vena cava and the aorta, thus preventing supine hypotensive syndrome. Okay, let's put a pillow underneath her head, a towel underneath her head. I'm going to raise, okay, and for more comfort, you can put a blanket. Okay, again, since this is an imaginary patient, let's just assume that her knees are slightly flexed. Okay, now, if we are right-handed, stand at the woman's right, facing the patient. Since I'm right-handed, I'm facing here, okay? Now let's move on to the first maneuver. Face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the fetus, since this is also called the frontal grip. The head, okay? Okay, the head feels hard and round. It is freely movable and balancable, and the breech feels notable and softer. Okay. Now let's move on to the second maneuver. We need to palpate in a downward direction on the side of the abdomen, applying gentle but deep pressure. This is also called the umbilical grip. So what I'm going to do is palpate downwards on the lateral uterine surface and determine the fetal back or fetal extremities. We need to apply a deep but gentle pressure, okay? Okay, now we need to proceed to the third maneuver, which is called the Polvex grip. And to do this, I will place my hand over the symphysis pubis, grasp the lower uterine segment with my thumb and fingers, okay? Determine if engagement has already occurred. Okay, now let's move on to the fourth maneuver, the last maneuver. Turn and face the woman's feet to confirm the findings of the third maneuver and determine the flexion of the fingers into the pelvis. This is also called the pelvic grip. If prominence is at the same side as the fetal extremities, then the head is flexed. But if the prominence is on the same side of the back, then the head is extended, okay? So we need to stand here. Okay, now we need to locate again for the back of the fetus and place a stethoscope over it and listen for the fetal heart tone, or as we call it, the FHT, for 1 full minute. Okay, so normal FHT is 120 to 160 beats per minute. Okay, in doing this, we will be using the bell of our stethoscope. Okay. That's 1 full minute. Okay, now we need to note the location, rate, and character of the FHT or the fetal heart tone. So the baby's FHT is 125 beats per minute, which is normal. So now we need to make the patient comfortable. Okay. Okay, are you in a comfortable position? Okay, now let's just remove this. Okay, now we need to document the observations made fetal presentation, position, altitude, and whether engaged or floating. So this is to promote database for future baby, for future. Okay, so as I observed and assessed earlier, your baby is at your right side, and it is in a cephalic position, which means that the head of the baby is at the lower part of your uterus and is already engaged. So this is ideal position for the baby in labor. So thank you, ma'am. That will be all. Your witness. Have a good day. So before we end our assessment, we need to do hand washing to deter the spread of microorganisms and to prevent contamination.